Hello everyone, this is Arash. I'm a medical doctor and I'm also working as an ISAM-GEN assistant officer, and I'm so honored to be here today with you. I'm going to talk about one of the other global surveys that we have run through ISAM-GEN, which is a global survey on problematic use of the internet. So I'm going to talk in 4 sections. First, I'm going to define the project. Then I'm going to go through the methodology. We insist on methodology because we want to say that how are our surveys in the global expert network working. Then I'm going to move through initial results and next the road ahead. So beginning with the project definition, we should be able to first define problematic use of the internet. As you know, we already had a panel this morning talking a lot about problematic use of the internet, how are the complexities in defining this definition. But right now I want to just point out to one of the papers that has been published in 2022 by Professor Feinberg, Professor Potenza. This is a narrative review on the advances in problematic usage of the internet research. They have provided a table on working definitions of various forms of problematic usage of the internet. As you can see, this includes gaming disorder, gambling disorder, online buying or shopping disorder, cyberchondria, compulsive sexual behavior disorder, cyberbullying, problematic social media use, and social hoarding. But in order to move on and have another overview about the terminologies around PUI, we have a ongoing systematic review being conducted by Dr. Mehran Zarabidoki, who's here with us today, and Dr. Mustafa Kamali. And as you can see in this picture, this systematic review shows that the terminology do not overlap a lot. As you can see, we have many publications stating the general PUI terminology, problematic use of internet, but the other terminologies do not really overlap with this general PUI. So this defines that we are still far away from having a consensus on the terminologies around PUI. Okay, I think this is not working. Okay, so moving now to what we defined in this global survey about problematic use of the internet. The first 2 subcategories are gambling and gaming disorders, which are the only 2 behavioral addictions that have formal WHO ICD-11 and DSM-5 definitions. It is more complex with gaming disorders in the DSM-5 as discussed earlier today, but we picked these 2 specifically. As I want to show you, the ICD-11 gaming disorder definition has the criteria, as you can see here. You can see impaired control over gaming, increased priority given to gaming other than other life interests and activities, escalation of gaming despite negative consequences, experiencing significant distress or impairment in personal and other aspects of functioning. Extending the period of the gaming disorder than more than 12 months, and also not being accounted for another mental disorder or being due to other effects of substances or medications. Moving to the 3 other categories that we have considered for this specific survey, we also chose problematic online shopping, pornography, and social media use, which do not have formal definitions yet, as I mentioned for gaming and gambling disorders. But these are the 5 categories that we have considered for this global survey to ask questions around. So the project's aim was to do a situational assessment of the importance and current state of problematic use of internet and its treatment in different regions of the world. Our esteemed PUI steering committee leaders include Professor Alex Baldacchino, Mark Potenza, Zsolt Dimitrovics, and Hamed Ekhtiari. We also have a group of actually steering committee who are also leading the project and providing their expert opinion on developing the questionnaire and running the whole survey. So now moving to the methodology, we submitted the protocol of this survey with the help of the University of St. Andrews and ISAM's collaboration, of course. The target audience of this survey were ISAM collaborating addiction medicine and psychiatry societies, as Hamed also mentioned in his first slides. We also reached out to our regional representatives to ask for their help in order to distribute the word to the to the societies in order for them to take part in the survey. The first draft of the survey was then designed. The survey was structured in 4 main sections. We started the survey with scenario-based questions, which were 6 scenarios, providing each of the subcategories as a scenario. We wanted the participants to get a sense of what we are initially talking about when we say online shopping disorder, when we say online gaming disorder. Then participants moved to the next phase, which was the importance of PUI, interest groups, training programs. The third section was about the health response towards that, and the last was about the severity of each of the subcategories. A big and huge shout out to Joe Schofield with his tremendous help that we were able to actually have the IRB approval by University of St. Andrews. And right now I just want to give you a glimpse of some of our results. I don't want to spoil the results because the survey is still ongoing and we are still reaching out to societies for more responses. But till now, we have 29 out of the 49 societies in our network participating in this survey. As you can see, we've started reaching out late July, and we have sent 3 reminders till now, till mid-August. So at the first round, when we reached out, we just had a response rate of around 8%. But then we insisted and we moved on with further reminders, and we engaged the ISAM Regional Council representatives, which helped us to gain around 60% response rate. And now moving to the scenarios, as I said, we had 6 different scenarios for the participants. I'm just going to go through one of them in order for you to get a sense of how we designed the questionnaire. I'm choosing Alma, which was the general PUI scenario, which was a 25-year-old female who worked as a software engineer in a multinational company. She spends most of her free time on the internet, browsing social media, playing online games, watching videos, general internet use. She often stays up late at night, neglects her sleep, hygiene, and health. She has lost interest in the things that she has used to enjoy before. She has become distant from her family and friends. She feels anxious and depressed, fantasizes about being on the internet when she's offline. She cannot reduce her internet usage, although she has tried several times to quit. She already feels guilty about being online in that amount of time, and her work performance is also reducing. So this is the case that the participants were presented with, and then we.
Arash, let's just make it just pretty engaging for people. Yeah, so sure. we have a case of problematic use of internet, and do you see these patients in your clinic, in your addiction psychiatry or addiction clinic? Christian, do you see patients like these scenarios? Who sees patients with these scenarios? Goodman, do you see patients with these scenarios? No. Okay, so there are people who are, okay, so, okay, okay, exist, but you do not see them in the clinical. Okay.
Yeah. Yeah, shall we? Okay. So after
tell you, Hamid, in our staff, we've had to make our lunchroom tech-free because of this reason.
Oh yeah, yep.
So no phones allowed.
We already have people here in this room that they have the same issue. So it's pretty frequent. Yep.
So after facing that scenario, people were asked 7 series of questions. First, how frequent is the scenario that you've seen? Then, who initially visits the patient? Afterwards, who will ultimately provide the final care? What treatment settings are available? What treatment options are available? And how do you evaluate the expertise of addiction workforce in managing such scenarios? And in a general form, how do you evaluate the capability of your country's health system in managing such scenario? So all the 6 scenarios, all these questions were repeated.
And so these are the surveys, and I already have Dave Martel here. Dave, we are waiting for your responses from Canada. So we are basically asking societies right now in terms of what is actually happening. And even kind of sending those surveys for people is just get them engaged in terms of asking, do we have any services for cases like this in our region? And if somebody, I mean, these are the challenges that people are facing around the world, right? Please.
Yeah. So as you can see, it appears that most of the organizations responded that the frequency is like it's frequent or occasional, which means probably most of the people who has responded to the survey has said that we have this type of patients. And it appears that the initial visit is mostly done by a GP or family physician and psychologists, and then they're mostly referred to ultimate mental health care professionals, as you can see, psychiatrists, psychologists, and addiction physicians. And the most treatment setting reported is it appears to be outpatient long-term settings, which I will also dive into this more deeper later. So in terms of the expertise of addiction workforce from the opinion of the societies, it appears that there are some levels of expertise, but around 45% appear to be novice or beginners in managing such scenarios from the point of view of the societies. Same goes for the health system capability somehow. Regarding the treatment options available for general PUI, as mentioned earlier before, we have randomized clinical trials for CBT, some trials for pharmacological therapies, and it appears that mostly have reported that CBT and pharmacological therapies are the most treatment options available. Moving to the next phase, to the next section, we asked about importance of PUI. So the scenarios are now closed. All those 6 scenarios, people were asked about the same questions. I'm not going to go through all the results. The second section, we asked about importance of PUI. Are there any interest groups available? Any training programs? Any specific certifications around PUI? How do you evaluate the severity of PUI at the current moment? And how do you estimate the severity in the next coming 10 years? Are there any research development programs available? And at last but not least, are there even any investment plans for education and development of PUI as a clinical field? So moving to the results, it appears that most of the participants think that the research and development importance is very important to extremely important.
And the participants are societies, so there are addiction medicine, addiction psychiatry societies in different countries, as you can imagine, how we can get them engaged in that process.
Yeah. And the current severity importance is also like around 70% have responded that it's very important or extremely important, but as you can see, they have estimated that the futuristic severity importance in the next 10 years will be much more. Regarding the programs available, there appears to be no much certifications around PUI, but there are available interest groups, but it appears that the next step has to come, and we move from interest groups to more programs and certifications as the societies have reported. Then we asked about awareness around PUI. How much are the addiction experts aware about this situation? And on the other hand, how much is the community and the public aware about this? Obviously, the experts are more aware, and some 8 of the participating societies has reported they are fully aware about the situation, and nearly around 70% are aware of the situation, but the community's awareness is not that much high. We could also think about this. Moving to the next question types, we asked about health response towards PUI. Are there any specific treatment programs available? Any specific expert awareness programs available? And specific general educational programs for the community available? As you can see, we asked societies to tell us about these questions if the program is available nationwide or it is available but not nationwide. As we can see, for example, for specific treatment programs, we only received available nationwide programs from China, not any other countries right now. And for the expert awareness program and general educational programs, almost goes the same. So what are the available treatment facilities for PUI from the opinion of the addiction medicine societies? We asked this through online short-term outpatient, residential, inpatient programs, and the long-term same programs from the societies. As I mentioned in the scenario questions, the results are repeated again, and it appears that short-term outpatient settings and long-term outpatient settings are reported to be the most available settings for treatments being received with the people who are dealing with PUI. And last but not least, we asked about the severity of distinct PUI branches, each of the 5 domains that I mentioned at the beginning, from very mild to very severe. And this is the results, showing that it appears that gambling severity from the eye of the addiction societies seems to be very like 8 societies have reported very severe to severe problems with gambling. Next comes social media severity, and the least is shopping severity, online shopping severities. So this is just a glimpse of the results. We have many more things to report, but due to time and as this survey is still ongoing, I'm not going to just give you more details here right now. So what happens now? The point is, we didn't just intend to collect data while running this survey. We were thinking that this program will bring awareness around PUI among the addiction workforce. Right now, we have conducted this survey with these societies, addiction societies, but we are planning to move this and run this survey with around 450 addiction individual experts in our networks from around 93 countries. And we believe this can help spreading the word of the problems around PUI within the addiction workforce. We are still waiting responses from the countries whose flags are here, as you can see, so please reach out to us, and we still wait for your responses. But there are other countries whose representative of addiction societies are also in the room, can also contact us and participate in the survey as well. And we will start receiving responses by the end of September 2024. And thank you very much.